today for today's briefing and invite them to submit their questions in the question platform here on Microsoft Teams, indicating their name and their media outlet. And we'd also like to welcome, as always, the viewers on Rogers Television, the Rogers Facebook page, and the Rogers YouTube channel, as well as those joining us on Global News Radio, AM 980 CFPL, and the folks tuned in on the CTV London website. Let's get to the opening remarks right away, and we'll start with Mayor Holder.
Well, thank you, Dan, and good afternoon, everyone. The Ontario government today is expected to formally extend its emergency order until June the 30th. That order, which has been in place for a number of weeks since mid-March, was due to expire today, but with the extension, it means that bars and restaurants will remain closed while social gatherings will continue to be limited to a maximum of 5. Now, given that 2/3 of all cases in Ontario are situated in the GTA, there's been a lot of talk lately about regional reopenings, especially allowing certain areas of the province to reopen before others. After initially saying no, the Premier has indicated he may be open to the concept. Now, these are discussions we've had at the staff level at City Hall, along with Dr. Mackie in the Middlesex-London Health Unit, and those discussions are ongoing. As of now, however, the Premier has yet to outline what options municipalities might have should he proceed with a regional reopening, so we're in somewhat of a holding pattern. Personally speaking, I remain extremely concerned about opening up parts of our city that could be considered tourist draws for harder hit communities less than 2 hours away. But having said it, in the event regional reopenings are permitted, are there things or services London could offer that would be of value to local residents and the local economy that would run the risk of attracting outside visitors? I think those are conversations worth exploring, and we will continue to do that with the support of the Middlesex-London Health Unit and all of our staff. Elsewhere, today we officially launched the 24th Annual London Cares Curb Hunger campaign in partnership with the London Food Bank. As with so many things right now, this campaign will look a little different. There will be no curbside pickup or donations, and fire stations will not be used as drop-off centers. Instead, non-perishable food donations can be left in bins at participating grocery stores or at the food bank itself. Also, financial donations can be made online at londonfoodbank.ca. And while donation methods have changed this year due to the pandemic, the need has also changed. We know it's never been greater. Too many families are having to make difficult choices when it comes to putting food on the table. I'm proud to say that we live in a community where that need is understood, and the challenge is being met. We saw just a few months ago when the Food Bank's Spring Food Drive had its most successful campaign in its 34-year history. So to the extent Londoners are able, I'm hoping they can respond in the same way once again for the London Cares Curb Hunger campaign, which runs until June 30th. That was a public service announcement that I thought it was particularly important to make at this time during the pandemic. Over to you, Dr. Mackie, please.
Thanks very much, Mr. Mayor. I'm going to go straight to the numbers. Locally, we had 2 new cases reported yesterday. Unfortunately, there was an additional death in the community and a woman in her 80s. Provincially, cases have bounced back up to the mid-400s, 446 yesterday. So we continue to have a significant ongoing outbreak at the provincial level. I'm going to stick there for now and look forward to any questions the media may have. Thanks, Dan.
Thank you, Dr. Mackie. Thank you, Mayor Holder. We do have one question right now in the queue, so we'll get to that right away. Mayor Holder, this one is for you. With the provincial emergency order extended, how will the city balance bylaw enforcement of a large gathering on Saturday with allowing Londoners the right to protest at Victoria Park? Will city officials be ticketing people?
Well, first, I think I'll go back to the organizers of this this march support. They've indicated that they're organizing it in such a way that they look to ensure that physical distancing is respected, that personal protective equipment, as appropriate, will be worn. And on behalf of the city, I appreciate that approach. I would add that they've been highly proactive in that area, and I'm extremely encouraged by that. As always, as the city, we work collaboratively when we have situations like this, and we are working collaboratively with the organizers of the march. It is my expectation and hope, as we have seen over the last number of of weeks, that fines would not be necessary. Those have only ever been put in place to protect the interests of the community. So if I can anticipate and hope, is that this march will be orderly and thoughtful, as has been indicated to us. And I look forward to a very strong response from the community with respect to this.
All right, thank you very much, Mr. Mayor. And I know that is something that's been on a lot of people's minds as we head into next weekend. Gentlemen, that's the questions we have today. We had the one. So a very abbreviated virtual media briefing today, and I'm just sort of, I know we're sort of stretching a little bit here to see if another question comes in, but I guess that's the way it's going to be on a sunny Tuesday afternoon. And as I say that, we got a couple more that have just come in. So, Dr. Mackie, let's go to those. Grant Demi from MyFM in Strathroy. Dr. Mackie, now that we're past the Mother's Day bump, what would you contribute today's increase to? Is it possible it's because the province has opened up?
So a few things at play. First of all, the opening up probably has something to do with ongoing cases. But there are a couple of other factors. First of all, we've seen case volumes of testing double over the past 2 weeks or so since the Premier opened up criteria so that anyone who wants testing essentially can get tested. So the testing volume has gone from 8,000 or 9,000 per day to 15,000 per day yesterday. And so that's going to find more cases, which is a good thing. It means we can isolate more people and trace more contacts, isolate them as well. Another major factor is the scenario in the GTA hospitals where William Osler Hospital was referring lab tests to Mount Sinai, and each hospital thought that the other hospital was responsible for notifying local public health. That plays a major role when local public health is not getting notified of those cases. Even if the cases are well counseled and are able to isolate at home, the contact tracing isn't happening. And nobody's calling those next close contacts to make sure that they are isolating and that they have the support they need to do that as well. So that easily could be a driving factor in the ongoing outbreak in the GTA. So a few things at play for sure.
Thanks, Dr. Mackie. We do have another question for you. This is from Heather Rivers, who is joining us today from the London Free Press. Yesterday, Dr. Mackie recommended that anyone going to the Black Lives Matter rally Saturday isolate for 2 weeks after attending the event in Victoria Park. Can you please tell us why and what is the risk?
Yeah, so this is really about enhanced social distancing, which is a key part of our response, regardless of your exposures. The gathering in large numbers in close proximity can certainly be a risk factor. I would say, we will obviously be monitoring for any cases that are linked with that protest. And if there are any cases linked to that protest, then we would be in touch through the organizers with the people that attended through their social media channels to make sure that those people are aware. The idea about isolating after any kind of major exposure like that, it's really an additional precaution. It's not something we would require from a public health perspective, but it would be something that could be helpful for those people to be particularly aware of their symptoms during that period, and making sure that they reach out to public health if they do have any potential COVID symptoms. Testing is widely available now at the assessment centers. So anyone that has those sort of large community exposures and comes down with symptoms would be strongly requested and encouraged to attend one of those assessment centers to get tested as soon as they have symptoms.
Thank you for clarifying that, Dr. Mackie. We have another question for you. It's from Jennifer Beeman, who is also joining us from the Free Press today. Toronto Public Health released a map of COVID hotspots showing cases or rates by neighborhood. Would London consider a similar move?
Thanks for the question. So really about would we release information by neighborhood? we have released information by lower tier municipalities. So if you're interested in what's happening in the county of Middlesex, you have that at the lower tier municipality level. Toronto obviously has a lot more data, and so some of those variations between neighborhoods would be more statistically significant. We could see variation between neighborhoods here in London that would be simply related to how many people were getting tested in those neighborhoods or other random chance factors. It's certainly something we can consider doing. I appreciate the suggestion.
All right, and we have another question for you, Dr. Mackie. It's coming from Grant Demi at MyFM in Strathroy, a follow-up to his earlier question. Dr. Mackie, the case count in the county hasn't changed much over the last week. Is there an update on resolved cases outside of London?
I don't have the exact figures on resolved cases, but I can tell you there are only a handful of cases that are still active in the county. We did look at testing in the county versus in the city. And although there are variations between county municipalities, the rate of testing is ever so slightly higher in the county, actually, than in the city of London. So that was helpful to know. I mean, we have the two large assessment centers in London. We put them in locations that would be accessible to the main population centers in the county of Middlesex, and we're happy to see that people in the county are using those assessment centers.
All right. Dr. Mackie, we've got another question, and it's kind of a little bit about what you mentioned before, and that was the increase in numbers that we're seeing. Dr. Mackie, a few weeks back, we started to see case numbers drop, but they seem to be rising again. Sawyer's question is this: are we seeing a resurgence, or were we not actually past the peak? Is it possibly linked to the number of places reopening? So a little bit more context, I think, for the numbers.
Sure. I think it's quite clear that we are past the peak of cases. We did see a peak in sort of early to mid, potentially late April, depending on how you look at the numbers. And we're down from the peak by at least 50%. But the problem is that our peak is now becoming a very wide, blunted, flat peak. So the disease levels are continuing at fairly elevated rates. And this is partly the function of the fact that we had a peak that was much lower. In a community like ours, where, and by ours I mean Ontario, where the rate of illness was much lower than other comparable jurisdictions like Quebec or New York or other places, Germany, France, Italy, fortunately, there are less cases and less deaths, but there's also less naturally acquired immunity. And so that immunity is part of what helps to taper off your pandemic wave. And that's something that we don't have. So it makes the physical distancing that much more important in our community.
All right. We do have one last question, Dr. Mackie, and this one is again for you. And I think it's building on what you talked about around the Black Lives Matter rally coming up on Saturday. Sawyer Bogdan at Global News Radio AM 980 CFPL is asking if there's any progress on coordinating health safety efforts for protest on Saturday.
Yeah, so at this point we have reached out and offered support to the organizers. We haven't heard back, so still planning on trying to do that before the rally on Saturday.
All right. Thank you very much, Dr. Mackie. Thank you, Mayor Holder. That does bring us to the end of today's virtual media briefing. We want to thank everyone who joined us today. We'll be back on Wednesday, tomorrow, June the 3rd, and we'll talk to you then. Have a great rest of the day.